I think what I think is really good and what's outstanding is the fact that it's more than something specific, it's a philosophy. In that, I think what's important for all of us as healthcare workers, it doesn't really matter in what role we are, is that we have impacts upon the rest of the system. So it's actually where PBC is actually having an understanding that general practice, rather than sitting in isolation, has a huge impact upon not just acute care services, but on the overall finances and the financial balance. So it's more the philosophy of how we approach what we do, rather than something specific, and I think that's much more important than a particular item. We need to be really strong in, obviously, with other community services, not just at a sort of individual patient level, but also at a broader sort of system level. Because even if I see a patient who's got suicidal ideation, as an example, I need to have a really good relationship and actually influence how the Mental Health Trust, as an example, actually would be able to both deal with that patient and manage that patient for the benefit of everybody. And if sometimes we can do that at an earlier stage and at a more appropriate stage, then obviously it saves, both from a patient's perspective, that crisis admission, which none of us really want, as well as obviously being better for the overall health economy generally.